chest pain. Oh.
Sir, we did a chest X-ray and we found out you've been diagnosed with cardiomyopathy. Your left ventricle is enlarged.
Well, what is this cardiomyopathy stuff?
Cardiomyopathy is a disease that makes it difficult for the heart to pump blood to the rest of the body. This disease can result in a failure of the heart and can potentially lead to death. For this disease, there are 4 main types. The first type is dilated cardiomyopathy. So here we see that the left ventricle is enlarged. So in this type, the enlargement of the left ventricle, it thins the membrane around that area. So as a result, it weakens it and it makes it extremely difficult for the heart to pump blood to the rest of the body, and it slows down the flow.
Second type of cardiomyopathy is hypertrophic cardiomyopathy. In this type, there's an abnormal thickening of the heart membrane, which strains the heart and makes it difficult for the heart to pump blood.
Type is arrhythmogenic right ventricular dysplasia. So in the diagram that's shown, the right ventricle is replaced by fat and scar tissues. So as a result, it shows similar symptoms to the first type. The heart dilates, the right ventricle dilates. It makes it extremely difficult for the heart to pump blood. And a different symptom shown is irregular heartbeats.
In this case, the muscles of the heart stiffen and it makes it hard for the heart to squeeze and pump out blood.
Meanwhile, at the hospital.
Now I'm just going to be testing you and checking to see if you're showing any of the symptoms. Are you experiencing shortness of breath?
Yeah.
Are you experiencing dizziness?
Yeah.
I've also checked and you have shown unusual heartbeat sounds. Do you experience chest pain after exercises?
Yes.
Have you ever fainted during physical activity?
Yep.
And in your lifespan, have you experienced swelling in the neck, ankle, abdomen, and legs?
Yeah, like yesterday.
So who really is at risk of having this disease? So the first is people with diabetes. The second is a person in the family who has had it. They could pass it down to you, and you could be at risk. The third is if a person has ever had any heart issues, such as heart attacks, they are also at risk. Studies have shown that in general, men do have a higher chance of inheriting or having this disease compared to females. About 1 in 500 adults have this disease. It's not that rare, but it's not that common either.
There's 3 main types of tests to diagnose this patient with cardiomyopathy. First, we use chest X-ray, then echocardiogram, and finally genetic testing. First, we get a chest X-ray of the patient, which revealed that the patient has an enlarged left ventricle. Then we use an echocardiogram, which uses sound waves to make an image of the heart and help us determine what the root cause of the symptoms are. Then we also consider genetic testing and screening to make sure that the patient's genetics weren't the reason that these symptoms were resulting. Though cardiomyopathy cannot be fully cured, you can be given treatments to suppress the effects of cardiomyopathy. For example, one of the treatments is giving medication which lowers the blood pressure and prevents blood clots. The second is septoablation, which is the injecting of alcohol into specific parts of the heart to break down thickened heart muscles. The other treatments that you can do to treat cardiomyopathy is getting an assisted ventricular device, which helps in blood flow throughout the body, and getting a pacemaker.
Being diagnosed with cardiomyopathy results in a few lifestyle changes, though they are major. The first is something called a cardiac diet. So in a cardiac diet, you have foods that are less in fat. This puts less strain on your heart. However, the fats that you want to include on your diet, they have to be healthy, and you also do want to include less processed foods, more whole foods, many fruits and vegetables, nuts and seeds, and you also do want to have fish oil a few times a week. The second major turnover in this lifestyle is the amount of exercising that you have to do. So if your medical professional advises you, you may have to exercise 30 to 45 minutes a day. This doesn't have to be heavy, it has to be light. You want to lie on the heart. This could include aerobic training, stretching, or light cardio such as walking. The video, I hope you learned a lot about cardiomyopathy and got a chance to expand your knowledge in the field of medicine.